This is Dr. Archana Karthik. I'm the fertility consultant and clinical director at Woodley Fertility, Banshantri, Bangalore. Today I thought I'll talk about tuberculosis, which is hardly spoken by people but very important for a patient who is trying to conceive. So tuberculosis in India is very common. All of us know India has highest number of tuberculosis patients when compared to other countries. So around 2 million cases were found in India in 2016. Out of it, majority of the patients have pulmonary tuberculosis. Pulmonary tuberculosis means it is for the lung tuberculosis. Very rarely there may be extrapulmonary tuberculosis or genital tuberculosis. Primary means usually pulmonary tuberculosis who have a lung tuberculosis spreads to your genital tract, and very rarely it affects only the genital tract. So usually it is secondary to your lung infection. So whenever you have tuberculosis, whether it is in your puberty or adolescence or just before marriage or just after marriage before you're trying to conceive, it should always be treated. Tuberculosis should not be neglected because it will even affect fertility. Coming to the genital tuberculosis, genital means the tract from where there will be childbirth. So uterus, fallopian tubes, ovaries and the vagina is the genital tract, where tuberculosis is very common, or very commonly it affects like 90 to 100%. It affects usually the fallopian tube. Fallopian tube means there are two tubes on either side of the uterus which carry egg from the ovary, and even the sperm reaches the ovary or the egg through fallopian tube. So fallopian tubes are very important when you are trying to conceive naturally or you are trying to become pregnant by simple methods like intrauterine insemination or IUIs. So fallopian tubes are very important, very delicate structures which are affected by tuberculosis. Next structure which is affected is usually uterus. It is affected in 50 to 80% of the cases, where uterus is the place where your pregnancy happens and the pregnancy grows. So the lining of the uterus or the inner lining of uterus is very important. That is where usually tuberculosis affects. If it affects the basal layer from where the endometrium should generate, then it will be very difficult for you to conceive because uterine lining will not develop so well when there is affection of the endometrium. The third structure is ovary. Ovarian tissue, if it is affected by tuberculosis, what happens is either the egg quality will come down or the egg number will come down, or you may not ovulate regularly because the blood flow to ovaries also will be compromised. Other structures are very rarely affected like cervix and vagina. So what are the symptoms? Usually that's what patient asks, how will I know I had tuberculosis? See, 80% of the patients with tuberculosis are asymptomatic. You will not know with any symptoms. Very rarely patients may have an evening rise of temperature. They may have little pain abdomen, little excessive white discharge PV, or maybe menstrual irregularities like maybe excessive bleeding during menstruation, or severe oligomenorrhea means your bleeding will come down very much less during your periods, and there may be even dysmenorrhea or pain during your menstruation. The last symptom will be infertility, that you are trying to conceive but you are not able to conceive. So these are the few symptoms with which you may come, but as I told you, majority will not have symptoms. So it's always better to go ahead with any kind of, if you are not conceiving well, when you are testing your tubes by hysterosalpingogram or HSG, the tubes will be beaded or thickened, or it may be blocked due to tuberculosis, or it may not be functioning well. But we as such don't have any test to see what is the function of the tube. But at least we'll know by appearance by laparoscopy or hysteroscopy also to see the cavity of the uterus. And the test for tuberculosis, we usually take a specimen from your uterine cavity. We send it for tuberculosis test like PCR. Along with that, there should be some symptoms or the signs when we look at your endometrium or your tubes that it is tuberculosis. Only when it is positive with all this, then we treat you with anti-tubercular drugs. So always the treatment is anti-tubercular drugs, which is for 6 to 9 months. So never neglect tuberculosis if there is any symptom. If not, also if you are not conceiving, there is tubal factor or an endometrium which is not developing well, or the ovary which is not responding well for your high dose of gonadotropins, then better get your GB-PCR test done. Usually your doctor will take a call by laparoscopy or by hysteroscopic route also to take out the specimen. So this is about tuberculosis. Hope it will help you in future, and thank you.